We are considering cure the problem of the previous cancer, the leukemia or cancer, not considering late effects. The aim of our intervention is to promote a total cure and total care. It means not only medical cure, but also educational cure, psychological cure, and social cure. So, considering that the aim of pediatric oncology is to help these children to be really cured in this large sense and able to become adults, actively part of the society. At the time of interruption of therapy, we speak with the children or parents saying that at this point the risk of relapse is very, very low, but we have to spend 3 years more to be sure or to can confirm that the child should be considered cured. Cured means that the risk is not zero. In medicine there is no zero, but the risk is so little that we are considering useful to give this definition of cure in order to reinforce the self-esteem of the child or young person, and also to give a message to the society that these children should be considered at any effect cured from their cancer. We know that after cancer or a very difficult experience, it is possible to have an evolution in 2 directions. The first one is so-called post-traumatic, post-disease stress, means sufferance, means depression and other negative psychological effects. Research in the last years is confirming that the majority, more or less in leukemia in particular, 80% of these children are really facing the post-traumatic growth. They, because of their previous difficult experience, they learned to face difficulties. They are really stronger. They have a philosophy of life stronger than their peers. These children or these adults are really able to face their life in a better way than the major part of the population. Yeah, it is important to recognize that these cured subjects are entering the society having the right not to have limitation or restriction because of their past story, the past disease. This is the topic should be better discussed, and we are considering that to offer really the total cure, it is necessary to consider to avoid the limitation also in the in reference to the insurance and job and other aspects of the life in the society. It is important to monitor the long-term impact of our treatments, and in order to learn how to avoid these possible late effects. One example, in the past, in children treated for leukemia with radiation therapy to the brain, radiation therapy, it was possible to observe after 5-10 years brain tumors. So, according to the evaluation of this problem, it was possible to remove radiation therapy, so secondary brain tumor disappeared practically. This is one example. Really, the problem is that in the last years, the treatment became more intensive, and so we have to balance how to give appropriate therapy, more intensive, but not to limit the possible late effects. And research, epidemiology, and monitoring of the events is important to try to limit these possible rare but sometimes important late effects.